everyone, I'm Easy Peasy Medic here. Today in my video, I'd like to talk to you all about anemia in details. So without further ado, let's move on to the definition of anemia. Anemia is defined when the hemoglobin concentration is low. This condition may be classified as normocytic, microcytic, and macrocytic. Move on to the types of anemia. The classification of anemia is based on diagnostic approach like history taking, physical examination, and initial laboratory investigation. Through history taking and physical examination, there are causes like hemolytic anemia which further divided into intracorpuscular and extracorpuscular hemolytic anemia. In intracorpuscular anemia, there are hereditary spherocytosis, thalassemia, paroxysmal nocturnal hemoglobinuria, and in extracorpuscular, there are autoimmune systemic lupus erythematosus. And in patients with physical agents like prosthetic heart valve and those who are taking cytotoxic drugs, as well as in patients infected with malaria and sepsis. Acute and chronic blood loss also leads to anemia. In bone marrow failure, here are a list of causes that may also cause anemia. Lack of nutrients like vitamin B12, folate, and iron. Infiltration like leukemia, metastasis, and fibrosis. Inhibition that are due to drugs and inflammatory process. Endocrine causes like hypopituitarism, hypothyroidism, and hereditary causes like thalassemia can cause anemia too. By running baseline full blood count, we have a variety of causes based on mean corpuscular volume which indicates size of red blood cells. In normocytic anemia, there are hemolytic anemia, bone marrow failure, and anemia of chronic disease. And in microcytic anemia, there are thalassemia, iron deficiency anemia, anemia of chronic disease, and sideroblastic anemia. And for microcytic anemia, I have a very special mnemonic for you to remember easily about their causes, which are fat, RBC. As the alphabet implies, there are folate deficiency for F, alcoholism for A, hypothyroidism for T, reticulocytosis for R, vitamin B12 deficiency for V, and cytotoxic drugs for C. Let's move on to the clinical feature of anemia. Pallor is common in all types of anemia, and normocytic anemia also includes signs of underlying disease. Take for example polyuria, nocturia, extreme thirst in chronic kidney disease, as well as finger clubbing, duplicar contracture, palmar erythema, caput mellusa, ascites, organomegaly in chronic liver disease. In microcytic anemia, other than pallor, there are nail changes like koilonychia, angular cheilitis, and angular glossitis as shown below. Same goes to macrocytic anemia. Other than pallor, angular cheilitis, glossitis, there are also subacute degeneration of the spinal cord and paresthesia. Common symptoms of all three types of anemia are fatigue, palpitation, headache, and dyspnea or shortness of breath. As you can see, in normocytic anemia, everything is in normal condition except that the hemoglobin count is reduced. In full blood count of the microcytic anemia, there are reduced hemoglobin count and normal white blood cell and platelet count, and in peripheral blood film of the microcytic anemia, anisopoikilocytosis and target cell can be seen in thalassemia, whereas anisopoikilocytosis, target cells, pencil cells, and teardrop cells may be seen in iron deficiency anemia. Mean corpuscular volume that is lower than 80 is considered hypochromic microcytic anemia. In iron study of microcytic anemia, normal serum iron, ferritin, and total iron binding capacity is thalassemia. Low serum iron and ferritin but high total iron binding capacity is iron deficiency anemia. Last but not least, low serum iron and total iron binding capacity but high serum ferritin is anemia of chronic disease, such as chronic liver disease and chronic kidney disease. Other investigations like endoscopy, stool microscopy, and barium anemia are to assess if there are possibility of getting diagnoses such as esophagitis, gastroesophageal reflux disease, schistosomiasis, and so on and so forth. Hemoglobin erythrophoresis is to assess thalassemia. In full blood count of macrocytic anemia, they have reduced hemoglobin count, reduced white blood cell count, and reduced platelet count if severe. In peripheral blood film of macrocytic anemia, they have reduced reticulocyte, neutrophil with hypersegmented nuclei, which are 5 or more loops, and target cells. Mean corpuscular volume that are higher than 96 are considered macrocytic anemia, and in iron study of macrocytic anemia, they have reduced vitamin B12 in vitamin B12 deficiency and reduced folate in folate deficiency. Schilling test is to differentiate pernicious anemia from intestinal causes of vitamin B12 deficiency. This is barium anemia to assess gastroesophageal reflux disease. And this is the morphology of bone marrow between normal and megaloblastic anemia. As you can see, hypersegmented polymorphos can be seen in megaloblastic macrocytic anemia. All underlying causes should be treated first in order to treat any kind of anemia. After treating the underlying cause, ferrous sulfate can be given in macrocytic anemia and hydroxycobalamin injection can be given in macrocytic anemia. Move on to the complication of anemia. Patients are more commonly complicated by fatigue and heart failure. I have come up with a case scenario here. I hope that you can involve yourself in this section and comment your answer down below before I announce the answer for this question. So without further ado, let's move on to the question. An alcoholic male patient comes to seek medical attention as he suffered lethargy for almost 3 months. Anemia, smooth tongue, and signs of chronic liver disease are found during physical examination. Full blood count show low hemoglobin, low MCV, low MCH, low serum iron and ferritin but high total iron binding capacity, whereas peripheral blood film shows hypochromia, microcytosis, pencil cells. Endoscopy shows esophageal varices. So in your point of view, what do you think of the diagnosis? And answer review in 3, 2, 1. Yeah, did you guess it correctly? Thank you for watching and lending me your ears. Please like and share my videos as well as subscribe to my channel. I will see you in my next videos. Bye!